Shana. How are you this morning?
I'm great. How are you today?
I am well. I'm glad that we're here to do our fifth edition of the Pat and Shana Show for all of the candidates that are taking the exam this year, whether they be students or other people looking for the portability to go from state to state. So this is always fun. We always like to do it. And today we're talking about the simulated patient exam.
Yep.
A little different than when we started. It was all patient.
That's right.
Yeah.
So we're excited to focus today on the simulated patient exam during this edition of Pat and Shana Show, as Pat so fondly mentioned. But we'd like to go ahead and start talking about, portability, why you're taking the ADEX exam, what are the benefits of the ADEX exam, so on and so forth. Pat, are you seeing the screen?
Yes, I am.
All right, perfect. Well, then let's get started. So one of the things we really want to highlight to begin with is just some information about the exam that you're taking and kind of what we're seeing nationally, right? So what we're currently seeing is about 210 dental hygiene programs from coast to coast are hosting the ADEX dental hygiene licensure examination. This serves about 275 schools because not all schools have enough space to host. So we do take this exam across the country, and over 80% of dental hygiene graduates for the class of 2023 are taking this examination. There are more of you out there also taking this examination for reasons of portability or what have you, but we are thrilled to talk about where this ADEX examination can take you. On our website, we do have these two fabulous portability maps. Pat, these maps have been recommended by lots of organizations within our profession looking for portability as we've seen a transition post-COVID.
Absolutely. ADHA always refers to them, as do so many other dental associations and institutions. I mean, this is something that Cdca Rep CETA is very proud of. A lot of time and effort goes into making these maps, keeping them current, and they change day to day. One time we were doing a session and it changed right before we were ready to go on air. And so they do change. Keep coming back and looking at them. It's a great resource for you. Always call your state board, which I'm sure Shane is going to remind you, but they are great.
Yeah, we do like these as a resource. I included, not only do all the other organizations use them, but so do we to help track what's going on with portability. And as a reminder, as we continue to move towards simulated patient, which is the map on the right, being accepted across the country. You do see a few states that are in different colors. Again, please do check our website. This is as current of information as we can gather. As soon as we have an update, we update it here. You can hover over each state. These maps are interactive so that you can gather the information you need for portability in the future. But it is an exciting time to be taking an ADEX licensure examination for the portability that it offers. That has been like no other year, right? No other year have they had. We just continue to get better and better in adding portability across the country.
Right. These maps look very different than they did a year ago. Very.
So we also, because we keep mentioning the ADEX exam, just to highlight, that is the name of the examination that you're taking. You are taking the ADEX Dental Hygiene Licensure Examination administered by Cdca Rep CETA. So we are the team coming to your schools, the friendly faces, those helping you through the process to prepare for that ADEX examination. The ADEX examination, of course, is the exam that gives you the portability. Pat's going to cover the OSCE in just a few minutes, but the ADEX exam is two components. It is a clinical component, whether that's on simulated patient or patient, and that written clinical OSCE, we refer to it, Pat will mention here, as a written exam, a computerized exam. You are taking this exam at a Prometric testing center. So it is an advanced examination administered on technology. It is not written anymore, but Pat will cover a lot of details of the OSCE in just a few minutes. The other thing we wanted to quickly cover before we get into the nuances of the examination is the exam cost. So as I mentioned, both exam components, the OSCE and the clinical component, are included in the exam fee of $1,075. The additional component that is included is a free retake should you need it. That complimentary retake is built into $1,075. We hope nobody needs it, But if you do, we hope it gives you a little bit of peace that you do have another opportunity within this exam fee to have an additional retake. Pat, I mean, this was something we introduced this year, this complimentary retake.
Right, just so there's no confusion, Shana, what about a complimentary retake for the CSCE? Is that included?
I'm glad you asked. The part that is complimentary is the clinical component only. If you do need a retake on that OSCE examination that you've taken at a Prometrics testing center, there is a fee of $275 to retake that component. No worries though, Pat's going to go over that. That exam has a pass rate that is acceptable across the country. I think you'll find that this exam is worth studying for. Hopefully a retake isn't necessary, but it is just the clinical component, your hand skills component that's covered in that complimentary retake. The other thing, Pat, I'll quickly throw out is some schools do have facility fees. So they do need to check the facility information sheet on where they're testing so that they know if there's a facility fee outside of the exam fee that might be incurred while they're signing up to examine.
Yeah, that's really good advice, not only for the facility fee, but there's so much good information that each school puts out on those forms, those sheets, those information sheets, whether it be about equipment or whatever. Really encourage everyone to, wherever you're going, to look at those facility sheets. And
Pat, you know, we've introduced both components of the ADEX exam. You're going to cover the CSCE OSCE for us. But before you begin, can you kind of elaborate, is there an order in which we need to take these exams? Is there a part that's first and a part that's second? What is the candidate expected to do when it comes to the CSCE OSCE?
Okay, that's a great question. And I think you get that question a lot while you're speaking to candidates pre-exam. There is no set order in which anyone needs to take these two components. Some people feel that the CSCE is a prerequisite to taking the clinical. That's not true. You take the CSCE whenever you are ready. You independently sign up for it through Prometric. You pick your own time, you pick your own schedule, and register individually. You tend to take your clinical either when it's at your school or at a site that's convenient for you. So you can take the CSCE before, you can take it after. It's just when you're comfortable taking it and when there are appointments available. So that's a real good question. I think a lot of people feel they need to take it first, but they certainly don't.
Pat, I will mention that you do have 18 months to complete both components.
Yeah, good point. And you do register it on your own, so you're not registering. You're eligible to register for your Prometric after you have registered for your clinical, but it doesn't, or when you paid your fee, but it doesn't mean you have to take it all at the same time. And I think those of you that are in school maybe get that feedback, but those of you that are taking it for portability, those of you out practicing, that's good information for you to have. And I think you'll feel that you're very prepared for it. This is the content. When you look at it, the medical assessment, everything here that's on this list are things that you do every day, either in practice or in clinic. It's approximately 100 points. We don't say questions because of the methodology of the questioning, but it's about that long. It has different types of questions. We're going to go through some of them. It is comprehensive. But the best way to study for it is by what you do in clinic and by what you've taken in your classes or what you do in your practice. It is, we always want to keep emphasizing this is not meant to be a national board. This is an entry-level clinical examination. If you look at the upper left, that's or it's to my upper left, that's an example of a question that we would ask about an intra and extra oral exam. It's something that you do on every patient. So it's something that you don't need to study for this, you know it. It is entry level.
Hey, Pat, can I ask you a question? Because I do think it's important to acknowledge the intra-extra oral component of the OSCE. That it is, as your chart over here indicates, the percentage of questions based on intra and extra oral examination through the OSCE type questions.
Right. That's a good point. And I didn't even mention that. If you look at those percentages, think of it as 100 points. And that mental math is easy, that when you look at intra and extraoral exam, there are approximately 27 points that are focused on intra and extraoral exam, and even radiographic imaging. It's all things that you do every day, and it's weighted according to the importance and how often you do it in practice. These are just types of questions. We call them alternative item types that just make it a little bit different. It's just not regular multiple choice questions. If you look over in the right, the extended match with a case presentation, look at the bottom where it has those little blue boxes in yellow. This is how a matching could be. It's not just one line that would go across. It could match with 2 items or 3 items, or it could be lots of crisscrossing. So this examination does evaluate your clinical skills at a much higher level, I'd say, than in a deeper level than would just a multiple choice test. You'll see a lot of drag and drop down here in the lower left. There's a condition or something, and you would just take and you would drag each of the stated into the present box or the not present. What do you see in that radiograph? Are these conditions there or not? And then there's the hotspot that everybody kind of likes. It's a touch screen. And we may ask you, to identify vertical or horizontal bone loss or caries. And you would just touch on the screen with your cursor where you think that is. So there's 2 visions there. There's 2 views. What you're going to see is that one that looks more like a radiograph, that sort of black and white one. And there's the caries. And in the back is, as long as your cursor hits anywhere where that green octagon is, then you're in the right area, and you would indicate that is where caries is. So there's a lot of these types of questions or questioning that makes it's more interactive as you go through. And as I say, I'm not going to say it's a fun exam to take, but it is certainly more interesting than just taking a multiple choice test.
I have 2 questions.
Okay.
First question is, how long do they have to complete the OSCE?
The OSCE is a 2-hour exam. And I'm going to anticipate that your second question is, what do I need to have to pass it?
Yes, you win.
Yeah. And the passing score is 75. And why don't you tell them when they're going to find out?
Yeah, you find out right there at the Prometric Testing Center. So before you leave, you will know your results of that examination. And as Pat said, it is 75 or greater. 75 is the minimum, right? We know you all are going to do fantastic and really overshoot that, but 75 is what you're looking to pass that examination.
And I do want to emphasize, it is entry level, it is clinical, and candidates tend to do very well on this examination. The content is what happens out in practice for an entry level, and it is meant to be that way.
So are we ready to move on to simulated patient?
Yes, let's do that.
All right.
So whether you take this exam first or second makes no difference, but this is your patient. A lot of candidates name their patients. I always say when we took our exams, we never forgot our board patient. I still can give you the name. I remember so much about them. So we want you to have that opportunity too. So why don't you give them a name? You can refer to your patient, and remember, this is a simulated patient exam. So everything that you do on this patient is what you would do on a live patient, as far as your infection control and your positioning and whatever. So hello, I am your patient. And as I say, give them a name. When I see you at an exam site, tell me what you've named your patient.
Yes.
So this exam is given in 2 quadrants. The maxillary quadrant is the calculus detection. That's just explorers up there, no scalars. You're going to be given an assignment of 4 teeth, and you will indicate the calculus on the 4 surfaces of those 4 teeth. And then your calculus removal is in the mandible. You will either be assigned the lower left or the lower right. Ultrasonic scaling is allowed. We have a caveat here, is if the school allows, and that was more of a COVID issue, I think, than anything else. Shana, we're pretty much every school is allowing ultrasonic use now, isn't it?
Yeah. And again, I would refer them back to the facility information sheet just in case, but there are, at this moment in time, there are not any schools that I'm aware of that is not allowing ultrasonic or piezo use.
And that information sheet will tell you if you're bringing your own, what type of connections or whatever you need. So the treatment time here is 2 hours. In that 2 hours, we do not polish. A difference from a patient exam, we do not polish. It's not evaluated or performed. Hard tissue and soft tissue damage are evaluated at the end. We have an administrative format of what we call a uniform start. When everybody gets there and everybody is checked in by the 2 clinic floor examiners, then everybody will be started at once. We'll be given a start time and then a finish time, which is 2 hours away from that start time. As I mentioned before, it's a simulated patient, so the minimal infection control requirements that we have, you must wear a mask, gloves, eye protection, and a gown. If there's anything additional that will be determined by the school, we always follow the school's infection control protocols. And you'll hear about that at the question and answer, the Q&A session that we have the week before. But expect to mask, eyes, eye protection, and gown and gloves. And yes, you can wear loops. I think sometimes
I was going to ask that.
Yeah, we do encourage loops. That's certainly not mandatory, but you can control your lighting, and I think you're used to wearing them. But what I'll say, we encourage it, but I'm going to take that back. If you are used to using loops, then use them for your exam. And during your exam, do what you're used to doing. All of the processes. So if you're used to wearing loops, then I encourage you then to bring your loops. There are, like no polishing, there are no radiographic requirements. You don't have to see calculus on any type of a radiograph. And the other thing too, while we're talking about it, is this might be a good time to talk about the grading. Do we want? Oh, I'll talk about that after. We'll do it after.
Yeah.
So what's going to happen when you're going to come into clinic? You're going to show your ID, make sure that it's current. And current, I mean, your license is not expired, or your passport, whatever you're using. The 2 examiners are going to, when you're all ready and you have your patient in position, we're going to look and make sure that the typodont is lying back in a position as would be a patient. You can't have them standing on their head. If you wouldn't have a patient in that position, you can't have your typodont in that position. We're going to confirm your assignments. We'll talk about that in a minute. And make sure that you're ready to go. When everybody's ready, the chief is going to announce that you may begin. Once you begin, you'll have 2 hours of treatment from that time. You'll also be given the finish time, and I'm going to show you a place where you'll write that down. When the chief announces the finish, and this is really important, that means instrument down. It doesn't mean, oh, I have one more place to check, or, oh, let me take the air syringe and clean this off, or, oh, I'm going to rinse. Don't do that. When they say the exam is finished, please put down your instruments, put everything down, and don't go back into the mouth. So then when you do that, then you're going to start cleaning up your working area, taking your mandible out, packing up all of your things, putting your mandible back into that plastic bag, and you will meet with the examiners for checkout. You will have done your findings, you'll have done your calculus detection and your probing. You'll have written them on the sheet that we're just going to go over next. And part of checkout is putting these giving these to the examiner, who puts them into the tablet, and turning in all your exam materials. If you get out into your car on your way home and you've got your plastic bag with your quadrant, you got to come right back and give that back to us, because we need to have that for grading. So all of your exam materials are turned in.
Pat, I do want to cover one thing. Once that mandibular arch is taken out of the typodont, that examination is over, correct?
That's correct. So the maxilla you're not going to take out, it will always stay in there. But when you finish, you will take out the mandible and wash it off and dry it. And that is an indicator that you're finished. So you can't take it out and then say, oh, I want to put it back in and do something else. Once it's out, the exam is over.
And I would assume if they really did physically leave with it, they probably wouldn't be allowed to just bring it back in.
Well, I say that as a joke.
Yep.
There's a whole team of us that are there to help you get through this exam. I often say, we can't scale for you. We can't do your calculus detection. We can't probe, but we really can help you with every other part of the process, with the forms. And if you think you're going to be able to leave this exam with your stuff, probably not going to happen. We are going to ask, we're going to have you going through the process. So that just is not really going to happen. We used to say that about forms and whatever, but now this exam only has one form. This is it, the one that we're looking at now, the assignment and candidate findings form. We refer to it as the ACF. This is it, which is great. So here's a candidate that would receive, you'll notice that it's all pre-populated, and that's what you'll get. You're going to get a form that looks just like this. If you're lower right, you're going to have it be purple on the top. If you're lower left, you're going to have it yellow. But right up there, it has your quadrant, which is your assignment, and this is a lower right. Your colleague or fellow student or could be sitting right next to you, and they could have a purple form too that says lower right, but they could have a totally different exam, because notice here, this is A. There are 5 versions to each quadrant. And so totally we have 10 different versions of this exam for the mandibular quadrant or the mandibular arch. So in this case, assignment is lower right, version A, and the examiners are going to come over and check your mounting and make sure that you understand all of your assignments and where they are and what you're supposed to do. And they're going to check you in by putting their examiner number in. That doesn't mean you start. That means you are checked in and you're waiting for the group start to happen.
Can I request a lower left if I get a lower right?
Well, that's a good try, but no, you can't. It's what you get is what you get, is a way of saying it. No, whatever you're given is what your assignment is. Because patients have lefts and rights, you have to be able to do both. And you can also expect third molars. So there are third molars on these typodonts. So the first part in the form here is the calculus detection assignment. This candidate has been assigned Ts 12, 13, 14, and 15. And if you look over mesial, distal, facial, lingual surfaces, there's a box for yes or no for each surface. You're going to explore the all 4 surfaces of those 4 teeth, and you're going to indicate if subgingival calculus is present or if it is not. If it is there, I think the instructions here to say put an X over the box. You can put an X, you can fill it in, you can circle it, you can do whatever you want, but make a mark for each surface. Either mark it yes or mark it no. What a lot of people do is go through and do all of the 4 teeth, and they'll mark where they do find calculus. And then they come back and fill in the nose. So they fill in the yeses, then they come back and fill in the nose. But we're just warning, we don't want you to forget to come back. However you do it, we don't want you to forget to come in and fill it. This is your worksheet. It can be done in pen or pencil. And if you make a mistake, you can erase, you can cross out. You are going to verbally give this information to us to put into a tablet. So it is your worksheet.
Pat, did you say the type of calculus we're looking for? You might have said that and I missed it.
Okay, no, I didn't. We're looking for light, moderate, or heavy calculus, any calculus. We're not looking for root planed, smooth surfaces. That is a no, or anything that's just a little grainy, that just needs a little root planing. We're not looking for that. We're looking for calculus that you insert the Explorer, it catches on it, and it would need to be removed. So light, moderate, or heavy. And we're not looking to trick you. We're not looking for smooth root plane surfaces. This is straightforward, light, moderate, or heavy calculus. Your calculus removal assignment. Okay, I'm going to remind you again, your assignment, as it says on the upper part of this, is the lower right. But in that lower right, every candidate is given 12 surfaces of calculus that have a higher points associated than the other surfaces. There are 12 that are worth 5.5, and we're going to tell you 10 of them. So these 10 are listed here, but I told you there's 12, we're telling you 10, so there are 2 that you don't know what they are. We call them the secret surfaces, the mystery surfaces, whatever you want to call them, they are there. I think our best recommendation that we can give you in this exam is look at that top quadrant assignment where it says lower right, and that is your assignment. Scale every surface of every tooth in that entire lower right, not knowing whether it is one of your 12 or it isn't one of your 12, treat them all the same because the other 2 are in there. And there are also other surfaces of calculus that are going to be in that quadrant that maybe aren't your 12, but you are also responsible for removing the calculus. And there are point values, lesser point values, but there are point values. So if you want to come back when you finish scaling the quadrant and give those 10 surfaces an extra check, sure, that's a good thing to do. But don't start off. I mean, if you were treating a patient, you wouldn't go to 26 facial and just scale that, and then go to 27 mesial and just scale that. That's not how you would treat a patient. Remember, simulated patient. You're going to treat this, type it on as you would a patient, and scale in the order that you normally would. Then go back and check. I think that's our biggest advice. In probing, you're going to receive assignment of 2 teeth, an anterior and a posterior. This process, the probing, is done after you have removed all of the calculus. So you can do your calculus removal, and then if you want it, whatever order you want to do all of the processes is fine. The only requirement is that the probing is done after calculus removal. If the calculus was still in there, it would affect what your reading is going to be. And remember, the graders are doing the probing measurements after. So that's what you want to do too. So you want to make sure that all of the deposits are gone, and that is one of the last things you do. We are going to give you some warnings. You are responsible for your 2 hours of time. We're going to give you some warnings, but the 15-minute left warning, or notification, I like to say, rather than a warning. If you haven't done your probing by then, that's a good time to do it. Because that's worth 12 points, and that's a lot of points, and you don't want to rush through it. So you do it at the end, but leave yourself time to do it. Remember when I said there's going to be a uniform start, and the chief will tell you your start time, and then we'll tell you what time you need to be done. Right over there on the right, where it says finish time, that's where you'll write it. So your chief will say your start time is 8 a.m. Your finish time will be 10 a.m. Write 10 a.m. in that box, so you'll have it to refer to, because once you get in the zone of scaling and doing your treatment, you may forget what time you started and what time your finish time is. So that's the ACF form. You're going to have it. It's your worksheet. It's your assignment sheet. If you have any questions about it, you go over it with the examiner that day. So we mentioned before that you don't take radiographs. You don't have to, and there are no requirements. That is all tested in the simulated patient exam, or the CSCE. That's where all of the radiographic questioning is done. So rumor has it that it was out there, and it is just not true. When graders are evaluating your work for that day, they are doing it with an Explorer. They're not doing anything with radiographs. They're not taking the teeth out and looking to see if there's any remaining subgingival calculus. That doesn't happen under the same conditions that you're scaling. The examiners are going to be grading.
Hey, Pat, how many examiners are there?
Right. That's a good question. There are 3. Every type it on is evaluated by 3 examiners. And 2 of them have to agree in order for an error to count. So let's say calculus detection, one of those 4 assigned teeth, you say calculus is present, and 2 examiners agree with you it's there, but one says it isn't, then you will get the point because 2 examiners agree with you. And the same is if it takes 2 to confirm an error. And these are the points that you're going for. The examination is 100 points. Calculus detection, again, it's 1 point per surface. 4 teeth, 4 surfaces, 16 points. This 66 points for calculus removal are those 12 surfaces that are assigned to you, that 5.5. So you can see that's a big part of the examination is 66 points. You're probing 2 assigned teeth, 6 measurements, again, 1 point per pocket depth. And your pocket depths are, because I know Shane is going to ask me this, it's a +1. You have a leeway of a +1 or a -1. I think you maybe are used to that. So that if you put down a certain number and an examiner is a number over or a number under, it's considered to be in agreement. So again, that's 12 points. That's a lot of points. Make sure you leave time for it. And then this final case presentation, this is the evaluation for the removal of all of the calculus on surfaces over and above the 12 surfaces that you've received as your assignment. So if you only scaled the teeth that you were assigned, you would be automatically probably missing at least 6 points and more points for the ones that you don't know. So best advice we can give you is whatever your quadrant is, scale every surface of that quadrant as if each and every one of those was worth 5.5 points for you. So your total is 100 points. And as you what we call you accrue points as you go through.
Do you want to just kind of point out, we know again that the exam to pass this exam is 75, and how heavily weighted calculus removal is from these two sections?
Absolutely. When you look at this, calculus removal is 66 points plus the 6 and final case presentation. So in reality, 72% of this examination is calculus removal. And it is heavily weighted, and that's probably where candidates tend to lose the most points, is in the area of calculus removal.
I know you don't want to spend a lot of time on hard and soft tissue trauma. It is something that we will cover today, but definitely not the focus of the treatment that's going to be rendered on examination day.
Absolutely. We do evaluate it, and it is evaluated by a penalty point system that if you do have an error, it is subtracted from those 100 points, whatever that you had earned from the that we just saw on that last score rubric. If you have one side of tissue trauma, you'll lose 1 point. What I do want to point out is the difference between major and minor. You can have 3 minor sites and lose 1 point each. If you have 4 minor sites, it advances automatically to a major infringement. So you go from -3 to -100, both on major and on minor. This is the exception and not the rule. Don't focus so much on this. I will say that with good instrumentation skills, whether it be hand instruments or power instruments, it is, number one, easy. I won't say easy. It is easy is just a perception. It is expected that you can remove all of the calculus without incurring tissue trauma. It's not a given. Some people think, oh, the tissue is different and whatever. It is different, but it is very realistic. It is good simulated tissue. And with good instrument adaptation, you easily can, there it is, that is that word again, easily. But you expect to be able to take that instrument and roll it into approximately and adapt it. It is expected that you will not have tissue damage. And sometimes when I'm talking about tissue trauma, I make that mistake, and I did last time when I called it tissue drama, because so many people think that this is the most important part of the examination. And the calculus removal is where the focus is, and it's the exception to the rule to have tissue trauma.
And Pat, with that, we say it over and over again about the hard and soft tissue trauma, but there is a video on our website. We all know you have found our videos because you're here watching this one, but there is a video of a candidate who actually took this exam last season. She tested in the morning. We recreated her day in the afternoon, and she's actually communicating with you candidate to candidate about her experience, and she addresses this without prompting, right, on her own, because she as well was part of the worrying of hard and soft tissue trauma. So she addresses and says the same thing we've said. So if you don't believe us, listen to somebody who's coming from the same position you're sitting in today, helping advise that, look, with proper instrumentation, angulation, tissue trauma really isn't a worrisome component of this examination.
And Shannon, I just wanted to bring up one thing that so often comes up at my Q&A sessions at exams. I'll have someone say, so that we don't experience any tissue trauma, should I bring instruments that are kind of dull? Mm-hmm. Absolutely not. No. You want to have your instruments in the condition that you would for optimal scaling. And you do not need to have dull instruments. You never want to treat a patient with dull instruments or a simulated patient. So bring your best instruments with you for sure.
And Pat, my answer to that, which we also get a lot in the live webinars, is if you want to avoid tissue trauma with dull instruments, you'll also avoid calculus removal with dull instruments, right? Both are avoidable with dull instruments, which is absolutely not the goal of the examination. So
that's great. I'm going to be stealing that. I think I like that phrase.
So our YouTube channel, which you all are already here, and thanks for joining us on here. There are some other videos that we'd like to have you watch, so please take advantage of all of this. One thing Pat normally will say earlier on in this meeting is that while we enjoy doing these, this is not meant to replace your manual. The manual is 16 pages, maybe 17 this year, long. So take those 30 minutes to read those 16 pages. Use these videos as a resource, but no, Pat and I are thrilled to be here and be a part of the process. But all the information you can gather will only make your examination day more comfortable and more pleasant for you as well. Pat, any closing thoughts?
No, I just want to wish everybody the best in taking it. I hope that their exam day goes smoothly. I want to say, trust yourself. You're well trained, or you've been out there practicing. You have a lot of experience. This is not the day to doubt yourself. Come in confident, show us your best. I always say this is the day for you to shine and show us how good you are. So remember, it's entry-level skill. It's what you know, what you've been training for a long time, and come and show us. And I hope you all do well. And I look forward to seeing you. I'm out at a lot of exams, and it's always fun for me to see you. Shayna gets to see you if you're in school and maybe doing a live webinar, but it's always fun for me to see you out on what we call the exam trail.
Yes, and we do love the feedback. So when you do see Pat,
Yes.
let her know you've seen her here in video. We do enjoy hearing that. Pat and I've heard it from across the country in elevators and everywhere else at the school. So don't hesitate to bring it up, because we sure do enjoy hearing about it. So,
and we've gotten some great suggestions, what people want to hear. Do give us your feedback. So this was fun. Thanks, Shayna.
This was fun. Thanks, Pat. You guys, we wish you the best, and we'll see you on examination day.
Perfect. Bye.
Bye.